Hey, good morning. Happy Tuesday, everybody. Dr. Miller here from Associates of Plastic Surgery in Edison. Just to remind anybody, anyone that has questions on Snapchat, feel free, send us a question. We'll definitely try to get back to you, okay? Today we're doing a blepharoplasty or lower lid surgery. You can see there's large herniated fat that's coming through. There's some wrinkles in the skin, so we're going to go inside to take out some of the fat, and we're going to tighten the skin with a little bit of laser. He also has some creasing here and in his cheeks, so we're going to inject fat to try to smooth everything out. Alright, so this is the conjunctiva. So we're starting our incision. He doesn't have a lot of loose skin, so you don't really have to make the incision outside. The main problem is the fat. We're going to put a stitch in here to retract the eyelid above. That is another way to help kind of protect the globe while we're doing the surgery. And then we'll just start to dissect on down. You can start seeing the fat bulge out here and here and here.
Skin edge.
Okay. This is the medial compartment. If you come, the middle compartment. If you come more medial, this will be the medial compartment. So we'll simply start dissecting the fat down, and we'll remove some. All right. So we have the medial compartment of fat. You can tell this because there's a separation here, and the inferior oblique muscle will be coming here. So we want to leave that intact. So we bipore the base. Clamp the extra fat. Excise it. And then we'll cauterize the stump here. So we don't want any bleeding back into the eye. That takes care of the medial compartment. And we'll go over to the middle compartment. Now here's the lateral compartment. It's always important to get this compartment because if I see any patients that have had blepharoplasty done completely, it's usually because they're missing the reduction of the lateral compartment. Now you can see all that fat that was bulging has been reduced, medial, middle, and the lateral compartment. So we'll take this out and we'll take a look and see. Now we put a single stitch in the conjunctiva to close it up. You don't need a lot of stitches because this incision line heals very well. I just put one in to kind of pose it into the proper position. Take it and we smooth it out. You can see the bags that were there have now gone. We'll tighten up his skin a little bit with the laser as well. and the fat goes into this crease. That way it'll be nice and smooth. All right, now we're starting the laser. Carbon dioxide laser. Just going under the eye just to give some tightening to the skin. We'll do 2 passes of this. And then that skin will be smoother underneath. So just to show you the fat we took out, this is the right side and this is the left side. From the medial, middle, and lateral pockets, it's all pretty similar, so we should have a similar result on each side. And then we're going back to the laser for our second pass. If you look closely, you can see the skin contracting when we do this. That'll make it much tighter with the skin under his eyes. All right, so here's the fat that we that we harvested from him. We're going to take it and inject it into what we call the tear trough and cheek area here. Massage it into position. We're also filling in his cheek area some as well. And so you can see before he had this big bags. Now that's much flatter. The skin is smoother. And then the area underneath, which was indented, is now being filled with the fat, so it's going to look a lot better.